What can we do to jumpstart a patient's natural healing system? How can we use EMDR to help trauma patients establish a sense of safety? And what can we do to help them get past roadblocks in treatment? We'll get into all that and more in this bonus session with Dr. Laurel Parnell and Dr. Ruth Basinski.
Hello, everyone, and welcome. I'm Dr. Ruth Basinski, a licensed psychologist in the state of Connecticut and the president of the National Institute for the Clinical Application of Behavioral Medicine. And I'm so glad that you're here today. We have a special topic. We're going to talk about EMDR, which we have done before in our trauma series. But this time, we're going to talk about attachment-focused EMDR. We're going to kind of bring together two ideas. You know, we talk a lot about attachment in this trauma series. Well, we're going to blend it and talk about how we would use attachment with EMDR. So we're really elevating EMDR to a new level by doing that. My guest today is an expert in this topic. She's actually a leading expert in EMDR, and she teaches EMDR at a variety of places, Esalen and Omega, and in Germany and so forth. And she's also the author of 5 books, most recently Attachment-Focused EMDR. Welcome, Laurel Parnell. Thanks for being here. I should have mentioned that she's a licensed psychologist and from California. Thanks for being here and welcome.
Oh, I'm happy to be here.
So, can you tell me a little bit about how did you get started connecting? I want to skip the how you got started in EMDR because we've heard a lot of origin stories for EMDR, but I want to get into, how did you connect it to, what made you connect it to attachment theory?
Well, I've been using EMDR in my clinical practice since 1991, and I was trained by Dr. Shapiro. I became a facilitator with the EMDR Institute. I've been training since 1995, and I've always worked with complex trauma. I've always worked with adults who were sexually and physically abused in childhood, always worked in mental health centers and with people who've had severe traumas. What I saw all along was that they needed more than the standard EMDR protocol, that they needed a lot more resourcing, they needed a lot more preparation, that they needed a safe therapeutic relationship. And so I've been teaching this, I've been evolving my thinking, I've been presenting for many, many years. And I was teaching at Esalen Institute maybe 4 or 5 years ago, and Daniel Siegel was there at the same time I was there. And he sat in on my course that I was doing, and I always do live demonstrations in my classes. And after his observing my work, he's the one who called it attachment-focused EMDR. And so that made me think, what is it I'm doing? What has changed in my work and to make this attachment-focused EMDR? And so I began to really look at what I'm doing and look at the attachment research and literature. And I developed 5 basic principles. And these are what I'm teaching and what I'll be talking about with you also. It just made sense. And also hearing Alan Shore and his presentation about attachment, and I began to think, linking up what he said with what I'm doing with the EMDR, that it actually has become quite different. EMDR, as it's being taught, mostly has become very rigid and very protocol bound, which is the antithesis of what you want to be doing when you're doing attachment repair work. And so taking my understanding of what is absolutely key in doing attachment work, neglect, clients who've been horribly abused in childhood, what's really necessary, taking those basic principles and integrating them into the EMDR therapy. That's how I've come to that.
Now, when you think about attachment, just tell us broadly the types of attachment types of styles, I guess I'm asking, of attachment. Are you pretty much using the same ones most other people use?
What I'm thinking about, and this is I want to get rid of all the categories.
Okay.
What I'm really teaching is, who is this person you're seeing and what are their needs? So it really reduces it down very, very simply. Rather than thinking in terms of categories, I want to really look at each individual. What are their needs? Where are their injuries? And how can we best repair those within the context of the relationship and with what I know about EMDR? So it's very individualistic, and it simplifies everything much, much more, rather than trying to categorize somebody, because I find human beings are just so very complicated. To really, with this individual, what's needed for their healing? Where are they having difficulty in their current life? What are their symptoms? And what's needed for the repair? So it's a much simpler model, rather than putting people in boxes, which I find, frankly, harmful. It's using what I know about each individual and what their needs are and addressing the treatment to that.
That's interesting, because when you've got EMDR and attachment, you've got really two sets of boxes traditionally. Yes. We have the categories of types of attachment, and then we have the protocols for EMDR, and that would be, categories upon categories.
Exactly. And so what I'm looking at is letting go of the boxes and working with basic principles.
Okay.
And using what we know is most important in the healing of attachment, and taking what we know, kind of the essential elements of EMDR, and putting those together.
Okay. So you talk about some basic principles, and perhaps we should just highlight those and briefly get you to explain what you mean.
Yes. So let me just say what EMDR is first.
Okay, good idea.
Yeah, I was saying we needed to do that. So EMDR stands for eye movement desensitization and reprocessing. And it's a very powerful trauma therapy that was developed by Francine Shapiro in the mid-'80s. What we do with EMDR is we activate the trauma memory in the brain with the image, the emotions, the body sensations, and the beliefs. We get it activated and lit up. And then we add alternating bilateral stimulation. Eye movements, auditory stimulation that goes right, left, tactile stimulation. The idea is to stimulate both hemispheres of the brain, that they create a very rapid processing effect so that the person moves to an adaptive resolution. You start with what's emotionally charged and held in a dysfunctional way. When you start this going, it moves to health and wholeness. So that's kind of EMDR in a nutshell, and there are protocols for doing this and that kind of thing. But at essence, it's quite simple because we trust that we have an inherent healing system in the mind and the body that is disrupted when a trauma occurs. And so what we're trying to do is kickstart our own natural healing system. So that's kind of the idea of EMDR. And so there were specific protocols that were developed with lots of scales and numbers and that kind of thing that Shapiro developed. And what we found is that for people who are very traumatized and who have been objectified as children, many of these very rigid protocols are actually harmful to them. They're experienced as re-traumatizing, as objectifying, as manipulative, and they don't feel safe. So what I did was I pulled from the literature what I believe was most important in terms of attachment repair, and the last two principles come from more specifically the EMDR part. So the first one is that you must establish safety. You must make the client feel safe, so that whatever we're doing from the first contact, the phone call, how they feel in our office, the preparing them before we go into the trauma processing work, even how we take the history, is there's a sensitivity to helping them feel safe with us. And it's providing sufficient resources so that they feel strong and capable before going into the very traumatic material. So the real attention to safety. The second one is that it's client-centered, and that what we're doing is we're adapting it to the needs of the client. So if they don't like eye movements, we're not using eye movements. If they prefer to be tapped right, left on their knees, if they prefer us to hold their hand to help them feel safer as they process, if they like to go long sets of bilateral stimulation and talk the whole time, or do they want to be silent and do short sets? So we're listening to, we're attuning to, we're adjusting what we do according to the needs of the client. So it's not protocol driven. It's not, the technique isn't primary, the client's primary. And so do they need us to sit far away from them, or do they want us to sit close to them? All of those kinds of subtle things we're asking them, what do you need? What do you need to be safe? What works best for you? And we adjust the protocols according to the client's needs. So it's very collaborative. There's a sense of connection and listening and attuning from the very beginning. So it's client-centered. The third thing is the importance of the therapeutic relationship. So the therapeutic relationship has got to feel safe. There's got to be a sense of connection. We're working together. And the client has a corrective emotional experience through the therapy itself. To the extent to which the therapist is attuned, connecting, resonant, listening, present, all of these kinds of things, adjusting what he or she is doing according to the client's needs, that's building in new neural pathways. And the therapeutic relationship, those moments of healing, of connection, can be made explicit and tapped in. Bilateral stimulation can be added to these moments of connection. And so the therapeutic relationship can be made, new neural pathways can be made explicit and then tapped in to change the whole nervous system. So that's the third one. The fourth one is the importance of the adding in of new neural pathways through what I call resource tapping. So what we have is we have EMDR, which is the activation of the trauma net and the adding of bilateral stimulation, and they move towards this adaptive resolution. Now, what I call resource tapping or resource installation is an EMDR-related technique where what we're doing is we're activating only positive resources, positive memories, positive qualities. What I call the four most important resources, the peaceful place, the nurturing figures, the protector figures, the wise figures, or positive memories of strength, of nurturing, of health, of wholeness. There's all kinds of positive memories and resources that can be activated. And then what we do is when those neural nets are activated, we add short amounts of bilateral stimulation. So if we're imagining a nurturing figure, someone who's nurturing and kind and loving, let's say a grandmother. So imagine her, feel her nurturing quality. Then we add a short amount of bilateral stimulation. We say 6 to 12, right, left, right, left. It can be tapping like this, either side of the body. It can be eye movements even. And what this does is it seems to integrate that information more fully into the nervous system. So what I'm calling resource tapping, I wrote a whole book called Tapping In about techniques for doing this. And I've included this in almost all of my books. I've talked about this resource tapping or resource installation, not just for the preparation for the trauma processing, but actually to lay down new neural pathways. So what we see with a lot of our clients who've had neglect or they've lacked stable parenting, they don't have secure attachment, what they're needing is to fill in these developmental deficits, to repair what they didn't get. It's like they've got these holes throughout their development. So the EMDR alone often doesn't do that because they didn't have those experiences to draw from for the healing. So what we're doing is we're adding them in. And it's amazing. This is the big shift. We're using the resourcing to prepare for the trauma work, but we're using it also to repair the developmental deficits. So we can imagine new parents, the mother you wish you had, and redo development, imagining having a mother like this. So they can begin with short amounts of bilateral stimulation, only focusing on the positive resource. But then if they go into a very positive reverie, kind of like Jungian active imagination, and they're really imagining what it would be like to have a mother like this and to repair all these times in their life, they can use a long sets of this bilateral stimulation, and they experience a healing of what they didn't get.
Do you find that patients always have a positive experience imagining the mothering that they didn't get?
Oh, it's complicated. There's no always about anything. And this is where you'll adjust what you do along the way.
What kinds of other reactions do you get?
Oh, there can be grief and loss.
Yeah.
Because they didn't get that.
Yeah.
And so they can experience a lot of sadness coming up. Or I mean, let me answer the last one first, because I was going to tell you the fifth thing in the,
Okay.
the principles, and I'll come back to that
That's
because there's
great.
a lot to say about that. But I wanted to give you the idea first that what we're doing with this resource tapping is we're using imagination of positive resources and bilateral stimulation paired together to repair these developmental deficits. And it's quite powerful. This is the big paradigm shift, I think. That's really the big thing that's added to standard EMDR. And then the last one, the fifth principle, is the use of modified EMDR. Now, the standard protocol with EMDR it goes, what picture represents the worst part, what's the negative cognition, the positive, we measure, and we either measure it, and then we bring it up again, and then we get the emotions, and then we measure that. And there's a lot of back and forth between right hemisphere and left hemisphere, and a lot of left hemisphere stuff. Trauma is stored on the right side of the brain. So when we're taking the person into the left hemisphere so much with the standard protocol, very often we take them out of the trauma net so fully that we can't get the client back in. It also disrupts the therapeutic relationship. It feels objectifying, manipulating, and many clients just can't do it. They feel, and it breaks the therapeutic alliance. So what the modified protocol is, which is a streamlined version of the standard protocol, we set up the resources, so we create safety in the beginning. And then we activate the trauma memory, have the image, and then we ask for what are the emotions. Then we ask for what are they experiencing in the body. And then we ask for the negative belief. So the negative belief comes right out of the body and the emotions. So it's spontaneous, it's connected. There's no thinking, is this the right, they don't have to figure it out. It comes immediately. And it augments, it amplifies the memory network. And then we go. Because we've activated it, they're in it, and then we go. We don't measure. I'll take what we call the subjective units of disturbance scale, the SUDS, if I can't tell that they're activated. So if they're obviously in it, they're crying, they're distressed, I'm not going to say, now, how disturbing is that, 0 to 10? It's obvious they're in it, right? If I can't tell, then I'll ask them 0 to 10. And then they're in it, and they process. And then the rest of it is pretty much standard, like, regular standard EMDR, except for that we don't ask for the positive cognition and we don't measure it at the end. We simply ask, when the distress level goes down, what do you believe about yourself? Often there's several positive beliefs, and then we put them all together with the image or the series of pictures that they've got. And so that's the end of it. So it's very similar. But it's really in the very beginning that we cut out a lot of the manipulative part, and we stay very close to the client's experience. And we eliminate elements that are going to make them feel objectified or unsafe, or that they can't find easily. So stay very close to our clients and our client's experience, and then we go right in. And then we've created safety before we even begin by having those resources established. So that's the fifth one. So that's the modified protocol.
Okay, so thanks for finishing that out. And what I had asked you is people's response when you are doing accessing resources, and specifically the mother that you never had. Right. Does everyone, and granted, there's never such a thing as everyone, but do most people find that positive? And you said, there are a range of reactions. And you started to talk a little bit about grief.
Yes.
Let's talk about them a little bit.
Yeah. So let me give you some of what I call roadblocks to this. Grief is one of them. Sometimes they hit, well, I never had that, and they really feel the pain of that. And I'll say, would you like to imagine this mother you've created holding you as you feel the grief of that? So they have the validation, and yet they're not all alone. They're being held as they're feeling that. Another roadblock is they'll say, well, that's not what I got. I didn't get that. And so I'll also say that's true. You didn't get what you needed. But you can change the way in which you feel inside. And I'll explain that the brain is very plastic. We can change the brain. We can change the neural pathways. So you don't have to continue to live with this emptiness inside. And so it's important to both validate it, but also give them hope that you can really change. You can rewire yourself, essentially. Another roadblock is they'll say, it's a kind of loyalty issue. I don't want to give up the mother I had. I don't want to lose her. And I always say, you don't have to lose her. We can do something about that. Why don't you keep her and the things you liked about her, and you get a mother who can be like an adjunctive mother, a co-mother who can fill in for what your mother couldn't do. So I'm all about using the imagination in whatever way. If this doesn't work, we'll figure something else out. Something that came up recently for someone was the whole area around validation, that they never had their reality validated. So I think maybe you need to have the reality of not having had a mother or being abused or having a horrible childhood. So maybe that what they need is to be able to tell the story of what happened to them with a compassionate observer with the bilateral stimulation, because a part of them didn't validate their own experience. And nobody outside of them validated their experience. So I call this a kind of a truth interweave, if you want, where they tell the story of what their truth was, what really happened with bilateral stimulation. And then I think you can get more of an acceptance of filling in what they didn't get. It's like they won't accept what they didn't get until there's been a validation of that they didn't get it. They feel like it's been candy coated, sugar coated.
Mm-hmm. Now, you talked about four different resources four different important resources, and they were a safe, peaceful place, nurturing figures, protector figures, the mother you didn't have, and so forth, and inner wisdom figures. Does any one of them tend to more frequently be the one that feels just right?
Well, what I do is I want to establish the first three with everybody I see. You know, and this is the other thing. I've been doing these workshops all over the country, internationally, on this attachment-focused EMDR. And what you'll see is that clients come in with all kinds of different issues, and its baseline is attachment, what we call borderline personality disorder, or people who are having difficulty in relationships, or it shows up in so many different ways. So what I do with everybody I see for a baseline is we'll do peaceful place. By the way, I rarely use safe place anymore, because it's a triggering word for anybody who's been abused. As soon as you say safe, they think unsafe. It gets associated in their brain, and then they get caught in a knot they can't think of anything. So I'll just say peaceful place, or a happy place, or a place where you feel good, or even a place where there's no conflict. It can be just doing a simple thing like petting your cat, or taking a walk, or having lunch with a friend, or playing music. So it can be some image that they associate that calms their nervous system down. So I'll do that one, and then I'll do nurturing figures. So I'll get a list of the figures that are real or imaginary that have a nurturing quality. It can be someone from their past. It can be someone from their present. It can be animals. It can be spiritual figures. They can be figures from movies or books. This is often a place where people who've been abused and neglected have difficulty, because there wasn't anybody who was loving or nurturing or kind to them. So then I'll start looking for, was there ever a teacher, or ever a neighbor, or your adult nurturing self, that part of you that's nurturing, or a spiritual figure, or somebody from movies or TV or a book. And so I'll start throwing out possibilities, and then we'll start coming up with things, even animals. And, you know, if you had a pet, or if you imagine, or you can have photographs from magazines, or even from YouTube of nurturing type figures, and see what they resonate with. So I'll get a list of them, and then we'll tap each of those different ones in. And then I'll do the same thing with protector figures. These are figures, real or imaginary, that have a protective quality. And it can be, there's all these action figures from movies. There's, you know, things from TV. There's your adult protective self, that part of you that would protect your son or your daughter if someone threatened them, for example. So I'm getting a list, and then again, I'm tapping those in. So I do those with everybody. Now, for some people who are more fragile, I want to do the wise figures also. So I'll say, can you think of figures who have a wise quality? And then we'll get a list of the wisdom qual. It could be His Holiness the Dalai Lama, or it could be someone that they associate, an elder, a Native American figure, or Martin Luther King, or someone.
Or Christ, or
absolutely Christ. Often Christian figures are chosen. Jesus is often used as a nurturer, protector, and wise figure. Yeah. So it's interesting to see what they come up with. What's so important with the spiritual figures is that they're not just be thoughts, that they have more of an authentic connection with the figure, that when they imagine them, they really feel that quality that's evoked. So that's one way of getting these wise figures. Another way is by doing a guided imagery to their peaceful place and then inviting their inner advisor or wise self to be there. And it's more of a spontaneous arising from their unconscious mind. And then it's a figure that it can be from a movie or a book or an aspect of themselves. It can be a power animal. People do all kinds of things. That might have Gandalf, or you might have a little fairy, or you might have an elf, or you might have some kind of spiritual figure that comes. These can be very powerful because they come right out of the unconscious mind. And then bilateral stimulation is used to install or tap them in. So, and then I'll say, would you like to imagine all of these figures together as a team? And so they can imagine them as a team, the kind of their inner support team. And sometimes they'll say, oh, yes, that feels really good. Or they might say, I can't imagine my grandmother and the grizzly bear together, right? They don't go together in the same room. So that won't work. So the team can be lovely. And then what I've got, I've been able to do kind of an assessment. What kind of an inner life do they have? Do they have resources that they can access easily? Or are they really struggling to find anything? You get a lot of information. I can see somebody who's been horribly, horribly abused as a child, but they've got all these resources. They've done a lot of work in their adult life, and they've got a wealth of resources they can connect to. That gives me a lot more confidence that I can do more of this trauma processing work sooner. If they're struggling, there's a real emptiness inside, they have a hard time coming up with anything, that lets me know that this is an area I want to work some more with to help them really develop this more fully for themselves. So I get a lot of information, and I think of it kind of like having airbags and seat belts in your car. I want to make sure I've got all the safety established. And then I feel safer in working with a client, going into this deeper material, and they feel safer. Then when we want to do EMDR on the big traumas, we'll call up those resources again. They'll feel them present with them. And then we can descend into the trauma network. We can begin and end with the resources. And if they get stuck in their processing and they get into very scary places, which is very typical with adults who've had physical and sexual abuse, they'll get caught in the old traumas. Then we can call up the resources to link them in for what we call interweaves and get them back on track and moving to an adaptive resolution. So they're used in a lot of different ways.
So perhaps it would be useful if we talked about a case study.
Okay. So how
about you tell us about someone you've seen recently?
Well, I'm thinking about, I've been doing these workshops all over, and there's a video. I have many, many videos of my work actually available through Amazon and through my website.
And I'd rather stay away from those if we could, because I think some of the people in the that are listening might have already seen some of those.
It's what's most fresh in my mind right now.
I see. Okay.
I have permission from my clients to talk about the cases, especially in something like this. So
okay.
I'm thinking about what I do have permission to talk about.
Sure. Go ahead.
I'm thinking about this woman who was horribly abused by her grandfather when she was 4 years old. And he was her most beloved attachment figure also. And she had lost all the memories for, I think, 30-something years. And then she began to get the memories back through flashbacks and nightmares and symptoms when her daughter was born. And then she didn't know what was going on. And, little by little, the pieces began to come together. So with EMDR, she had been able to establish the memories of what had happened. And so we targeted one of those memories. And what had happened was her grandfather, she said he orally raped her and physically raped her. I don't know what you want to call it, vaginally raped her when she was 4. And she said what was most disturbing was the image of his face before he attacked her. Now, he was also one of her most beloved people, and he was an attachment figure for her. So what we did before we began is we really established a strong relationship. And she needed me to see her and to see her strengths and to align with her strengths. She didn't want me to pathologize her. She didn't want me to see her as broken. She wanted me to connect with all the strength in her, yet also recognize how the hurt that she had, the damage that she had because of what had happened to her. So we did this. I really reflected back to her, seeing her strengths and knowing her strengths. And then we did the resourcing. And so she had a lot of really good resources. She had a lot of spiritual, she had Jesus, she had Mary, she had Grandmother Oak, she had wise figures, she had animals. She had a wealth of resources. And so we tapped them all in. I think she had, she was doing tactile stimulation. She was holding these little pulsars in her hands. So she had tactile stimulation, and we had this whole team installed. So she really felt good about that. And then she told me the story of what had happened to her all the way through, which was really, really tough to hear. And then before we began the EMDR, we got all the resources back again. So she felt the resources surrounding her in the room. And I told her that she could close her eyes to go deeper into the network we were going to process, and she could open her eyes to create more dual focus. So that's one way. Some people, when they close their eyes, they get very, very deep into the experience. And when they open their eyes, they get more distance. So that's what we did. She closed her eyes to go in, and then at different times she would open her eyes and she would meet my gaze, and then she would go back in. So we set all of this up according to her needs. So she directed it. She told me where she wanted me to sit. Oh, by the way, she wanted me to sit so close to her with my knees touching her knees. And she said that felt like she was grounding through our contact, which I don't usually sit that close to my clients, but she needed that. So our knees were touching. She had the tactile stimulation. She was going to tell me what she needed as we went along, and we had all those resources set up. And then she went in and the image, so we did the modified protocol. The image was her grandfather making this really lewd face at her before he molested her. The feelings were terror and disgust and distress. She had a lot of stuff going on in her body, a lot of feelings in her body. And the belief she had was, I can't protect myself. And as soon as she said that belief, she began to sob and sob and sob and sob. And so I had the bilateral stimulation going. And she had a lot of associations, a lot of stuff going on, processed through it. She did a lot of talking as she processed. And so she came through that, and then she reported her experience. When she came through, she would put her glasses back on. She would take her glasses off to go in, and she'd put her glasses back on to report. It's like her adult self was the one with the glasses on. And then she would go back in again. Her emotional releases were extremely intense. So she was sobbing really hard. A lot of mucus was coming out of her nose. She was really intense. But then she'd come out, and she really had this dual focus of awareness where she could very clearly describe her experience. So we processed through a lot of stuff, a lot of stuff through this. And at one point she thought she was done. Oh, at one point she got stuck because she had the oral rape part. And she said she didn't feel like she could get it out. And so I said, what do you need? This was my inner wave. I said, what do you need? I need to get this out. Who can do it? And she says, Jesus. So she brings Jesus in to remove the penis from her mouth. And she bursts out laughing. And she says, that'll teach him. That'll teach him. She bursts out laughing because it's a funny scene. And then she has this huge feeling of energy shifting. And she feels like there are all these angels behind her, and they're getting rid of him, and like this satanic thing. What she felt had happened, she had a series of insights, was that somebody had done this to her grandfather. And that's why he had done this to her, and that he was abusing her basically in a dissociated state. that this other energy, if you want, had taken him over while he was abusing her. That was a big part of her insight. And then she hit a lot of compassion for him and understanding and grief for her grandfather. So this was, a long session. We probably did over an hour with this. The last quite a while that we did, she kept coming back to stuff that was still left in her throat. There was things that she needed to say. She needed to say no and back off and stop it. And then there was also the sensations of what was left in her body from the oral rape. That was body memory stuff left. And then the last piece that I just had I had an intuition I asked her about. She never told anybody. She never told. I said, because her grandmother told her, if you ever tell, your beloved grandfather will be taken away and you'll never see him again. The grandmother knew. Oh, the story, which I didn't tell, was grandfather did this. She passed out. He thought he killed her. He put her in the shower to wash her. Grandmother comes home, sees her, puts her in the bathtub and scrubs her vagina, puts her in a little dress and takes her to dinner and tells her never to tell anybody because her grandfather will be taken away if she ever tells. So she forgets it for 30-something years. So that was a big part of the story. What she tells in the processing was the reason her grandmother did that was because her grandmother had been abused as a child also. And so grandmother was behaving out of her dissociation. So grandmother, grandfather, both abused, both behaved out of their dissociation. So
she's pretty protective of them.
She was integrated. She was integrated. So it was part of the integrative process of the big insight as to where their behavior came from. So she yelled at him. She expressed her anger at both of them. That was part of these different channels. So she definitely processed all of that too. She told them what she thought of them. She said no. And she also integrated where their trauma had come from. In the end, she imagined telling. And she imagined telling. She got someone who was a protector to come in and take care of this thing. And then she imagined she was telling me, she was telling the whole group, and she was telling the video camera and everybody what happened. And again, it was this huge release for her in the throat, in the throat chakra, the whole throat area opened up, and she felt all this energy moving through her. And so she ended with her resources all around her. She ended in a really good place. She imagined her little child wanted to go out and play. So her child went out and played and didn't want to think about this anymore. So that's kind of and we did a bit of a debriefing.
It strikes me that could have been hard for you to listen to. Some parts of it, it was very sweet at the end, but some parts of it could have been pretty hard for you.
How do I put this? I've been working with abuse over 30 years. I've been working with this. And what I'll tell you what happens with EMDR. Before EMDR, it would be much harder. What I know now is this works so well, is that I align with their strength. I align with a part of them that's whole, that's been through this already. And I know she's going to get through it. And I'm listening, I'm attuning, I'm connecting with her. And as it's passing through her, it's passing through me too. So it moves through both of us. And so it's hard, but not so hard, because I know she's going to be fine. So these stories are really hard. And I know when I present a lot of this material, it's horrible to hear, but everybody I'm presenting has gotten better. So they've moved through these awful, awful things, and they've come through and they're free of it and they're living full lives. So there's a feeling of having been through something intense at the end of a session, but it's a good feeling. You've been through something intense, but you're on the other side of it. Mm-hmm. Yeah.
Do you ever do tapping or EMDR with yourself?
When I have an incomplete session, meaning they don't get to a zero at the end, they don't have a clean, their body isn't free of this stuff, I feel it left in myself. So I've got these little EMDR headphones, and I'll put them on and I'll focus on my body and I'll listen to the tones go back and forth as I focus on my body, and any imagery or anything that's left in me, I just let that pass through me. And there's a sense of real relief afterwards.
Let's talk a little bit. We don't have a ton of time left, but let's talk a little bit about love. And because you've written a bit about that, the power of love and so forth. And you say that love can be a powerful healing resource. Can you share a little bit about what you mean by that?
Well, what I found, and this is with, I kind of discovered this by accident with a man who'd had really, really horrible trauma. And I couldn't find peaceful place. I couldn't find anything to calm his nervous system down. It was like really, really tough. So what I knew is that he loved his children. And so I said, I just tried this. I said, bring your awareness into your heart and think about your son. Now think of your daughter. What are you feeling? Oh, he's feeling this warmth in his heart and a feeling of relaxation. Then we added the bilateral stimulation and he felt it more fully. So I went, this is going to work, because love, when you're feeling love, you're not feeling fear. It's hard to feel the two at the same time. So what I found is that the feeling of love activates the parasympathetic system, and it helps release oxytocin. So you've got these two things going on. And so for some people, we're getting the bonding neurochemical released, and we're getting a sense of calmness and relaxation with that. So there's a lot of different ways to work with this. And really the way I think of with this attachment focused way of working is I want to go in the door that's the easiest to go into. Like for someone to think of someone who's loved them can be very hard. But it can be easier for them to think of people that they have loved, or even animals they've loved, or children. So you just start with the easiest way in. So think of someone you've loved. There's, it can be an animal, a pet you've had, or a friend, tender feelings towards, and you just start there, and they recall them, they recall positive memories, and then just use a little bit of bilateral stimulation. And you can do more of this. So then they can imagine, if they can, start with sending love out. And then you can also then now think of the people who've loved you, if they can do that, or even a pet who loved you. And then think of the ones who loved you and then tap those. And then there's the loving kindness meditation, which is where you bring your awareness into your heart center. Oftentimes begin by sending loving thoughts towards yourself and then sending loving thoughts towards others. And then you can add the bilateral stimulation to that to really increase that.
Now, the loving kindness meditation comes from Vipassana,
right?
Which is one of a branch of Buddhist psychology, or I guess Buddhist meditation. Have you thought much about the integration of Buddhism with EMDR, with attachment, trauma?
My entire career, I've been doing Buddhist practice since the early 70s. So it's all integrated in. It's all completely integrated in. I wrote an article for the Journal of Transpersonal Psychology. I think it's 1996 on eye movement desensitization and spiritual unfolding. So they go so well together. I mean, the simplest way of thinking this AIP model we have with EMDR, it's really, I think of it as that the true self is like the sun that's always shining. And the manifestation of the true self is love and compassion and empowerment and wisdom, these essential qualities that are blocked by our conditioning. They're blocked by the clouds, by the things that have happened to us, our interpretation of those, and how they get caught. And so what we're doing with EMDR is we're focusing on the clouds. We're bringing awareness to these places, to the fear, to the hate, to the anger, to the anxiety. All of those places is where the attention goes, and then we do the bilateral stimulation, and those things burn away. What's left is compassion, is joy, is freedom. Those are kind of essential qualities. You can keep doing bilateral stimulation on love, and it doesn't go away. Passion doesn't dissipate. Anger dissipates. Fear dissipates. So really, we come back to our essential manifestation. So yeah, I've written about this. I've been teaching about this for years, and it's really what we see. And so we can take some of these essential qualities and we can focus on them more directly with memories, with experiences, and then use bilateral stimulation with those.
And have you very directly integrated meditation into your work?
Well, in my classes, we begin with meditation, and I
Mm-hmm.
teach basic Vipassana or mindfulness meditation. And in most of my trainings, we end with a loving kindness meditation. And in almost all of my books, I've written about the loving kindness meditation and how helpful the mindfulness practices are in developing some of the most important qualities the therapist should have in doing attachment
Yeah.
repair.
Yeah.
So that's in this latest book too, because being able to be present, being able to listen to your body, the attunement, all of that comes out of meditation practice.
Well, and also the latest research, especially research for counselor education or training of therapists, shows that mindfulness meditation can be very, very effective at helping new students who are learning to be therapists to have the kinds of traits that you would want them to have, the ability to be present and to show up and be there. And a lot of the research is going towards compassion, and so that kind of fits in too.
Well, and also what happens is when you do this practice, and the practice is you're sitting, you're watching your breath, your mind wanders, you bring it back, have a feeling, you allow that feeling to be there and unfold. What's happening is you're developing a dual focus of awareness. You're developing a witness awareness that just notices mind-body phenomena without identification with it. And so this is not who I am. And not only is it not who I am, it's not who the client is. So when the client's having all these intense feelings and these hatred and love and all these, you just know it's mind-body phenomena that's moving through them, and it doesn't define who they are. And so there's more of a freedom. I think that's why some of this doesn't affect me so much. It's just noticing it as mind-body phenomena that's moving through that doesn't mean anything about who the person is essentially. So all that's moving through in this space that's quite, it's a vast space. It allows it all to be there. And the meditation really helps develop that. So as I'm not worried about my own so-called countertransference reactions, I'm just able to notice them and maybe be curious about it. I'm communicating that to the client. The non-judgmental stance is communicated to the client non-verbally, right?
Mm-hmm. Yeah. Yeah. So I just want to say thank you. This was fascinating, and I think you've made an important contribution in the way that you've blended these ideas with the EMDR protocol. And, I just wanted to make sure that people had a chance to hear about it. So thanks for what you do, and thanks for being part of our program today, Laurel.
Oh, thank you. It's been a pleasure talking with you.